Hello. We are going to be working today on Periformis muscle and doing some myofascial release for that. Periformis is one of the 6 deep hip rotators, and it is often very famous because it can be involved in a problem that is called piriformis outlet syndrome. And when that occurs, it is impinging the sciatic nerve. The sciatic nerve starts somewhere around the low back and the lumbar spine. It moves down through the SI joint, through the deep hip rotators, and down the back of the leg through the hamstrings. And sometimes when it's impinged, we experience pain in any one of those places and maybe even all the way down into the toes. So we are going to start today in releasing that with our foam roller. And we can start by just bringing the foam roller into the low back area here. So we're going to maybe hold our knees so that we have a little support just to feel that low back is against the foam roller. And we can just gently move side to side so that we're coming across the vertebra of that low back area. Nothing should be painful here. If it's a little tender, then maybe identify that tenderness and just take a deep breath and kind of let it go so that we can feel ourselves releasing that tension and melting into the foam roller. So we have to have some consciousness of what is pain and what is tenderness and where this is good for our body or where maybe we need to stop. So definitely listen to our bodies here. To go ahead and start moving down the chain and getting a little deeper, we can begin to move our hands behind us here. The fingers can either be back, sideways, or forward. That's not really very important. It's just kind of what feels best to your shoulders. And we're going to gently begin to move ourselves into a position where we're sort of on the actual tailbone. So we feel a little pressure of the foam roller against the tailbone here. And eventually we can just work our way up into a seated position on the foam roller. For video purposes, I'm going to come into the center of the camera, hopefully here. So we're just going to roll now on the glutes from the sitting bones all the way up to the tailbone. Again, just sort of identifying how we're feeling in those tissues. And usually people feel the sciatic nerve being impinged or the piriformis being tight on one or the other side. Maybe it's both for you. That's okay. We are going to do both today. But I'd like for you right now just to come into whichever side is the most painful for you, where you're having that issue. So for the sake of this video, I'll use my right hip. And I'm just going to shift my right hip into the center of the foam roller and take that ankle over the opposite knee. And I'm going to sort of shift my weight into my right hand here and take my left hand over that knee maybe. This is all kind of depending on your body strength. And now we're on the outside of this side of the deep hip rotators. So we're rolling from that area around the sitting bone all the way up to the glute medius, which is near the low back. And if you're having a problem on this hip, you're probably making a face that looks something like this right now. And that would be good because you've discovered where that issue is. But again, when you find that place, just stop and take a couple deep breaths. Maybe don't even move anymore at this point, other than maybe a gentle rock or even shifting the body sideways with a little friction almost. We're not moving the skin here, but just jostling the tissues so that we can feel like little circles, little diagonals, cross fibers, ups and downs being made to release that trigger point. Shifting gently again, you might find another one, and again, just breathe into that. We're trying to make changes here, scaling that tenderness back a little. Beautiful. So when we're ready, we can go ahead and just release that hand, release that leg, bring ourselves back into the center of the foam roller, maybe observe how we're feeling different on the left and the right side. And here we'll shift into that opposite hip and again, come into that side body. Now, I'm not going to venture into that too much right now for the sake of the video being kept short. But when we're finished with that, we can go ahead and just set that off to the side. And we are going to move to our myofascial ball. So this is actually a lacrosse ball, and you can buy these at most sporting authorities, Dick's or Walgreens, or sorry, not Walgreens, but a Walmart, Target, etc. And also you can find a lot of these on Amazon. So we're going to just bring ourselves down into a lying down position here. We're going to pick the hips up and put this ball underneath kind of the SI joint, somewhere near the area there at the back of the spine and the tailbone area, but off center a little bit. And what we're trying to do is maybe just to bring that leg down so that we begin to feel that we're sort of finding a trigger point there with a little more pressure of this particular ball. And when you find it, you can just take a few breaths, maybe wiggle over it a little bit, maybe reposition the ball so it's coming down towards that side of the hip a little bit. And really, there is no prescribed amount of time or reps that we do when we do myofascial release. It's really just about finding how we feel and noticing that melting away. So now we're going to cross the right leg over the left leg. And we're going to just gently kind of push that knee open a little bit. You'll probably feel a nice stretch in the deep hip rotator starting here. And you can stay here and just wiggle the hip side to side a little bit if this is a lot for you. Maybe the intensity is pretty high. But if you want a little more, you could take both hands and reach down behind the left leg, or the opposite leg, I should say, and using the elbow to just gently push that knee open, we begin to draw that opposite leg in towards the chest. And finding a little organic movement here is good as far as breathing into the release and the stretch of those deep hip rotators. So again, you can stay here for a few breaths, just noticing changes, positive changes happening in the body. Bring that foot back down whenever you're ready. Hug the knees into the chest. Feel a nice release of the low back here. And take a few mindful moments to just breathe into the healing of your body. So there we have it. That is our practice for the release of the piriformis muscle and how it affects the sciatic nerve. Have a great day.